It has rocked Canadian health, jobs, and social life in just 5 weeks.
COVID-19 can be characterized as a pandemic.
Tonight, life with COVID-19 and how we get past it.
That reckoning starts with the dead. Now 1,000 loved ones and counting, so many in seniors' homes.
Every time the phone rings, my heart stops.
From new heroes on the front line to new hope for slowing the spread.
We actually pulled it off.
And the urgent race for a vaccine.
We'll need that to fully unlock the economy. Today, shocking numbers affecting real people.
My gigs had been canceled.
And so, new measures.
And what about this familiar call out?
Stay home.
Stay home.
Stay the blazes home.
We all know it, most are doing it, but are the rules too much?
People are asking, can I have a beer with my neighbors?
On health, jobs, and how we get together, Canadians and COVID-19.
How we live with it, how we move beyond it, and when. This is The National. Good evening. I'm Adrienne Arsenault.
And I'm Andrew Chang. For all the uncertainty of this pandemic, there is one thing we know for sure. It's already irreversibly changed a lot of lives.
Like those mourning the more than 1,000 Canadians killed so far and the healthcare workers who tried to save them. The heartache is amplified in long-term care homes. Today, a desperate plea from Quebec's premier struggling with the staff shortage for surgeons to step in and help take care of seniors. And in Ontario, there's a new action plan to try to contain the virus's spread. So today alone, more than 200 new COVID-19 cases were reported linked to long-term care homes in Ontario. Ellen Morrow now with a very real fear that creates among families and care workers.
There's so little that we can do. It's really hard.
Kat Cizik's father, Jerry, moved into a long-term care home just a little more than 6 weeks ago. Visits that used to look like this, now more distant.
Every time the phone rings, my heart stops and I worry about what news is coming in next.
Her father is symptom-free and there's no outbreak at his home. Still, as the death toll mounts at long-term care facilities, Cizik is anxious.
This is a broken system. They've been so short-staffed. The people that work there are not getting paid enough. They're not getting the kinds of terms of employment that any of us would expect.
Today, Premier Doug Ford revealed more about his plan to help. Infection control teams are set to be deployed to high-risk homes within 48 hours. Residents from older homes may be relocated to help with isolating the sick, and Ontario will work with Ottawa to boost care workers' wages.
When we get hit with these crises, you wake up real quick, and there's a lot to be fixed down here. I can promise you that, and we will fix it.
Yesterday, Ford announced care workers would no longer be allowed to work at multiple homes. That order will only last 2 weeks for now. Charlene Stewart's union represents 60,000 healthcare workers.
They're frightened. They're worried about contracting the virus themselves. They're worried about taking it home.
Dwayne Simon was worried too, so worried he's taking his mother out of her care home where 4 residents have died.
Like, this is a rescue mission for me. I got to get my mother out. You know, she has dementia, so it's going to be challenging looking after her, but you know what? You have to do what you got to do.
It's an option few may have, and Simon doesn't know if his mother has the virus. While they await her results, they'll be isolating at home together. Ellen Morrow, CBC News, Toronto.
And what's happening, of course, in care homes now is bringing to light issues from the past in Ontario. That includes a change made before this crisis to how those facilities are inspected. John Lancaster with what the province is saying today about what our CBC News investigation found.
A CBC News investigation revealed the Ontario government has essentially stopped so-called RQIs, or resident quality inspections, in long-term care homes. They're detailed, often weeks-long inspections that check staffing levels, training, and safety standards, including infection control measures. Today, the province defended the decision.
We moved to a risk-based inspection process, really to make sure that the homes that were at highest risk were getting the attention that they needed.
Inspectors are going into most facilities every year, but often just for a few days and only to investigate specific complaints. But just 9 of Ontario's 626 long-term care facilities were subjected to full RQIs last year.
The inspections are critical.
Sue Hilton's mother is recovering from a leg injury at Anson Place in Hagersville, Ontario. COVID-19 has killed 19 people there. It hasn't been fully inspected in almost 3 years.
When you start ripping funding away from healthcare, this is what's going to happen.
At these 3 care facilities in Ontario, COVID-19 has claimed 81 lives. None of the homes has been fully inspected in at least 18 months. This advocate says the province has betrayed residents.
The RQIs look at very different kinds of issues than what would come through, for example, complaints or mandatory reporting. It's what keeps the homes sort of honest.
The Ontario government used to fully inspect almost every care home every year, but the association representing care homes urged the government to step back, arguing homes are overburdened with documentation and restrained by rules and inspections. Sue Hilton thinks RQIs may have helped minimize the spread of COVID-19.
That's one thing that I've questioned with all of these retirement residences and nursing homes is, where are the infection control specialists?
That's one measure RQIs are supposed to ensure are in place. John Lancaster, CBC News, Toronto.
The COVID-19 crisis in Quebec's long-term care homes today prompted a desperate plea to doctors.
We need you to do the basic work. I appeal to your sense of duty to help us take care of the elderly.
François Legault estimated there's a shortage of 2,000 nurses and personal support workers because so many have fallen ill. There are outbreaks in 142 facilities, both private and public. So the Premier made a special plea to surgeons in particular, since elective surgeries have been cancelled to free up beds for pandemic patients.
Back in Ontario, COVID-19 has killed at least 1 resident of Participation House. That's a group home that supports adults with physical and mental challenges. It doesn't get the same funding as long-term care homes, but as Tashana Reid shows us, it suffers the same dire problems.
Of the 42 residents who call Participation House home, 37 tested positive for COVID-19. Many of them immunocompromised or with physical or developmental disabilities. This morning, resident Martin Frogley passed away. In a statement, his family thanked the staff who were with him in his final days, saying he passed peacefully, listening to music he loved. He was a wonderful son, uncle, and the best brother anyone could ever ask for. Ivy Albania is one of 12 care workers who tested positive for COVID-19.
We are heartbroken, and we are sorry that we cannot do anything. But even if we wanted to, there's nothing that we can do right now.
The home has been understaffed since the virus hit. When residents began showing symptoms in early April, Albania says staff started asking for protective gear, but they were told the ministry didn't require staff to wear them.
Every single day, there's 1 or 2 staff that will call in. They said they're sick, and then residents as well.
Scott Kerr pulled his 21-year-old daughter Emily from the home. She tested positive and is recovering in hospital, but he's worried about others.
It's heartbreaking, when you see these people that are not going to pull through this.
Emily's doctors won't release her until the home has more resources.
The painful lesson to be learned is that we really need to be getting as much funding and support for these care facilities to take care of these most vulnerable people.
Today, the Premier of Ontario said more help is coming.
The people that stayed there, and there was less than a handful, and I just want to thank them for staying at their post.
Albania says she plans to get back to work as soon as she can. Tashana Reid, CBC News, Markham, Ontario.
Now, across Canada, the number of cases of COVID-19 has now surpassed 28,000. And while we are still seeing more than 1,000 new cases a day, there are once again more positive signs tonight. The country's epidemic curve tells part of that story. Today's numbers are slightly lower than yesterday's and lower than the high point recorded earlier this month. Still, as the curve appears to flatten, the number of deaths remains on the rise. Christine Birak explains why and what's next.
This pandemic could have gone a couple of different ways, but Canadians are clearly flattening the curve, saving hospitals from being overrun with sick patients. Still, over 1,000 people have now died from COVID-19, hundreds more than the government had predicted by this date. Likely the result of a surge in seniors dying inside long-term care homes. But doctors say we're heading in the right direction.
This week, next week, we'll hit a plateau and then we'll start to go down. You only know that you've peaked when you see it in the rearview mirror.
This outbreak has a lag time. Those who are losing their lives now became sick about 2 weeks ago. As the number of new infections slows down, so too will deaths.
We're in the lucky position of trying to talk about what's next without having gone through the hell that other countries have gone through.
But the Prime Minister insists that hell could still happen, and Canadians must be patient.
It would be terrible if we were to release restrictions too early and find out that we're suddenly back in another big wave of COVID-19.
After easing early restrictions, Japan recently declared a state of emergency and is now seeing a spike in deaths. So when might it be safe for people to come out of isolation?
I don't think there's a medical answer to that question. It's a societal judgment.
Researchers are now speculating on how Canadians could return to a new normal, including a gradual release of people from isolation.
My best guess is the first batch is people who are fairly young and don't have health conditions. Because while they'll get infected, they're much less likely to get very sick or die.
Canadians have given scientists and the government time to find a new path, but there will be hard turns in the road ahead. Christine Birak, CBC News, Toronto.
Now, much of that road ahead will depend on the recommendations of Canada's Chief Public Health Officer. Tonight, Dr. Theresa Tam was asked about that timeline during a CBC News virtual town hall.
The first thing and our key focus is really reducing transmission to a very low level. And that means testing, that means contact tracing, and making sure we isolate cases and quarantine the contacts. That must still continue. Even if we go past the peak, we need to maintain all of those measures, including physical distancing, for quite some time because of the lack of immunity to this completely novel virus in Canada.
So while this will be our new normal for some time, Dr. Tam did applaud Canadians for their efforts made towards flattening the curve.
The government expanded eligibility today for emergency financial help. Now, seasonal workers, part-timers, and those on contract can apply. And as David Cochran shows us, help cannot come quickly enough for some.
This is just one of the 5 jobs Rebecca Gray works when things are normal. She's an aspiring opera singer, a paid choral performer, an usher at a concert hall. She makes her living working in crowds.
It's really dried up because there's no more church services, there's no more concerts. My gigs had been canceled.
So when the crowds went away, so did most of her income. The one job she could keep was teaching violin, which had to move online.
So I'm making about $200 a week from the teaching job, but $800 a month does not cover any kind of basic living expenses here.
It wasn't close to enough, but it disqualified her from getting federal aid. Until now.
If you earn $1,000 or less a month, you'll now be able to apply for the CERB.
The gap Rebecca Gray was falling through is one of several the government is closing.
If you were expecting a seasonal job that isn't coming because of COVID-19, you'll now be able to apply. And if you've run out of EI since January 1st, you can now apply for the CERB as well.
It's a lifeline, even if it isn't perfect.
This is a really important step, and I'm so grateful that finally they've addressed some of our concerns, but there's still going to be that dynamic of everyone is trying to figure out, okay, how much can I work so I can still get the benefit?
Missing from this announcement was help for students who don't qualify for support right now. The Prime Minister promises that will change and that the details are coming soon. David Cochran, CBC News, Ottawa.
Now, as that money helps individual Canadians through this hard time, we are finding out tonight how hard it may still become. StatsCan today announced the economy shrank 9% in March, and the Bank of Canada expects it may contract by as much as 30% by the middle of this year. There is a glimmer of hope, but it's well down the line. Peter Armstrong explains.
You need look no further than your local Main Street to see how hard Canada has been hit. The Canadian economy has shut down. The data just catching up.
There are many, many businesses that are concerned. They haven't been able to pay, and they don't know what their fate will be.
Global GDP is now expected to fall 3%. By way of contrast, it fell just 1% during the 2008 financial crisis. In Canada, economic activity will fall a staggering 6.2%. Even the Bank of Canada isn't sure what happens next.
Policymakers can do little more than to cushion the blow.
The lockdown has clobbered just about every sector, but especially those that employ lower-income Canadians.
Different groups within society have been hit, more seriously than others. We know from the employment data that women, youth, and minorities in many cases are being hit disproportionately hard by layoffs and furloughs.
But if you squint just right, you can begin to see what a recovery may look like. Once the health crisis subsides, the economy will creak back to life. Your local shops and bars and workplaces all hope to reopen eventually.
The longer it goes, the harder it will be to rebound.
The IMF says a blockbuster year is coming. Global growth will soar by 5.8%. Canada's GDP will rebound by an eye-popping 4.2%. But that's still the better part of a year away.
You can flick a switch and open a Starbucks. It's a lot harder to tell people, go shake hands, go to a movie theater.
This past month has felt like a lifetime. It's reshaped our lives and our economy in ways we can't even begin to measure yet. Peter Armstrong, CBC News, Toronto.
So those closures will continue for some time. Today, British Columbia extended its state of emergency.
Cabinet today reaffirmed the state of emergency, extending it for another 2 weeks, ensuring that all British Columbians stay the course.
Premier John Horgan says it is critical BC remains committed to keeping new case numbers low. On the same day, the province reached 75 total deaths due to COVID-19. Saskatchewan's state of emergency was also extended for at least 2 weeks. However, Premier Scott Moe says he expects to lay out groundwork for lifting some restrictions next week.
These layoffs are mainly contractors, part-time workers, seasonal workers. Clearly, a lot of that work is not going to be done this year.
Halifax is cutting nearly 1,500 jobs and canceling summer programs as cities across the country grapple with shortfalls from the pandemic. Winnipeg also announced almost 700 layoffs today. They mainly include those who work at recreation centers, pools, arenas, and libraries.
Well, around the world, research teams are racing towards an unprecedented goal to develop a vaccine within a year. It's never been done that quickly. But as Vicatopia shows us, the progress made so far is also unprecedented.
In a pandemic, this is being promoted as must-see TV.
This is the road to a vaccine.
The online show's creator is pharmaceutical giant Johnson & Johnson, one of the dozens of developers around the world racing towards a vaccine. 4 other research teams have already shifted from the lab phase to clinical trials and human volunteers, one in China, the other in the UK, and 2 in the US. One U.S. trial vaccine uses the DNA sequence extracted from the spikes on the coronavirus. When injected, a person's immune system is trained to seek out those spikes.
Anytime you see any signature, something that looks like this spike, anything that has this spike, go pounce on that with the full force of your immune system.
There are more than 60 other potential vaccines in the works in labs. This Canadian team is working on one of them. Some vaccines use all or part of a dead or weakened virus. Others use its DNA or RNA. This vaccine expert says having multiple versions is critical.
So you want redundancy. So it's very important that that all this research is being done, and hopefully there'll be 5, 6, 7, 8 successful vaccines, because we have a whole globe that we need to protect.
Vaccines usually take 5 to 7 years of lab research, animal studies, and clinical trials in humans, but coronavirus research is moving at hyperspeed, a potential risk.
My concern is that in the fear and in the haste to develop a vaccine, we may be tempted to tolerate less than optimal science, and that to me seems unacceptable.
Health officials predict it'll be at least another year before a vaccine is approved for wider use. With no treatment options on the horizon, immunization is the only end game in this pandemic. Vic Adopia, CBC News, Toronto.
Canada's long-term care homes are some of the hardest hit in this pandemic.
My goal and everybody's goal here is that COVID-19 doesn't get into Sherbrooke.
Ahead tonight, lessons from a home that has held off the virus.
The game tonight has been postponed.
In our special coverage, we'll also revisit the week everything changed, and our doctors will look ahead to what the future could bring.
For the orderlies and the medics.
And a very special musical tribute on the front lines of the hard times.
Sing a couple verses for the doctors and the nurses.
We're back in 2 minutes.
Today, the mayor of Los Angeles said he may cancel concerts and sporting events until 2021. It's an indicator of the long road ahead. But the White House has a different message. And as Paul Hunter tells us, it's one many Americans want to hear.
In the U.S., growing fury at the still shut down economy. This demonstration today in Lansing, Michigan, slamming the strict guidelines to stay at home, demanding a return to normal in the face of experts who warn it's still too early for that.
Our community is struggling. We want to go back to work. We have employees. We have paychecks to issue. We have bills to pay. The only stores open are Walmart? That's ridiculous.
It's time to open up. The sick are being taken care of. If you're sick, stay home and in your house. The ones that can work need to work.
Elsewhere, desperation. Check this monster lineup for food in Austin, Texas, with handouts to those who've already run out of everything. And outside Los Angeles, more cars in the many hundreds. Said one volunteer they'll keep giving until the food runs out.
We'll be the comeback kids.
Tonight, Donald Trump said there's been enough progress on COVID that he'll announce tomorrow new guidelines on reopening the economy.
We want to get our country back, and we're going to do it, and we're going to do it soon.
Health officials have warned reopening too soon risks a resurgence of COVID. These images are from Maryland just this week. And Washington, D.C. today extended its stay-at-home orders until mid-May.
We're still in the woods.
In New York today, Governor Andrew Cuomo said he's now ordering all New Yorkers to carry masks whenever they step outside.
And they must wear it in a situation where you cannot or are not maintaining social distancing.
Still, Trump said tonight the U.S., which leads the world in coronavirus deaths, is now past the peak on new cases. He said his announcement tomorrow, perhaps naming states that can soon reopen, will be very exciting. Paul Hunter, CBC News, Washington.
Up next on The National, we look at the week COVID-19 changed our world.
Our weather is 6 degrees in Vancouver right now.
Well, scenes like that may feel like a lifetime ago, but it was just 5 weeks ago that a declaration set off a dramatic turn of events.
Okay, in just a few moments, our doctors are here to take your questions, including some pretty big ones like this. What concrete sign are you looking for that might signal we're beating this thing? Does it really come down to a vaccine? We're back after this.
Welcome back. We've been thinking how to mark the start of this crisis. What day? The virus first appeared in December in Wuhan, the first case in Canada at the end of January. That didn't yet feel like it was here. March 11th, though, that was a turning point. The week that followed, a rapid-fire series of events leading to this limbo we live now. So let's look at the week our world changed.
Our weather, 6 degrees in Vancouver right now.
Consider what Canada looked like on the morning of March 11th. It was the week before March break in most of the country. Schools open, planes flying, streets busy. Canada's first COVID death had been a few days earlier. Total cases here, 100. Total cases in the U.S., 1,000. Total cases in Italy, 10,000. That country, the advance warning of what was coming. Maybe that morning, COVID-19 felt distant to your lives. That would change by nightfall. That day, the WHO declared it a pandemic.
We're deeply concerned.
Then everything moved quickly and strangely. An NBA game at around 8:40 p.m. was abruptly canceled.
The game tonight has been postponed.
Everyone ordered out because Utah Jazz player Rudy Gobert had tested positive. He, by the way, is the player provocatively touching all the reporters' recording devices 2 days earlier. A joke, he said. Not funny. Over on another channel, the former vice presidential candidate Sarah Palin was rapping as a pink bear on The Masked Singer.
My fellow Americans.
A performance interrupted in the U.S. by a presidential statement around 9 p.m., a travel ban from Europe.
This is the most aggressive and comprehensive effort to confront a foreign virus in modern history.
And just as the world was digesting that, a quick reminder, anyone can get the virus. Tom Hanks and his wife declared they had COVID-19. This is a special edition of The National. Strange night, the penny had officially dropped. Consider the pace of the next few days. March 12th, Sophie Gregoire Trudeau tests positive for coronavirus. The NHL suspends the season. And Canada was getting to know the names, faces, and measured compassionate thoughts of the medical officers of health, clearly worried about what was coming.
And I just know how stressful it is for our healthcare system, for my colleagues, and for families that are dealing with this.
The come home, then stay put message started coursing through the country on Friday the 13th of all days.
Today, my advice is to postpone or cancel all non-essential travel outside of Canada.
While nearly 500,000 Canadians abroad started working on trying to get home, schools and businesses here started shutting down. For a moment, at least for the kids, the idea of canceled classes felt like a novelty.
I got to go to my grandparents.
Anxiety had certainly crept in for the adults. Monday, March 16th, a declaration that would have seemed unthinkable weeks earlier.
We will be denying entry to Canada to people who are not Canadian citizens or permanent residents.
And the economic costs of COVID were moving in hard. The Dow Jones lost nearly 13%, the biggest one-day drop since the stock market crash of 1987. Did we grasp a few weeks ago that the economy would get so bad so fast? That the infection numbers would climb so fast? That Monday morning, Canada had 425 cases. The United States, 4,000. Italy, 25,000. Did we realize on a St. Patrick's Day without parades and a schedule without sports that we were learning how to cheer for a new team? This was the week we first got out the pots and pans for the healthcare workers. Think of what that ritual has become. That's the week COVID-19 became a prism through which we now look at everything. Science soared in respect. Traffic, where'd that go? And generosity? Maybe we always knew that well was deep in Canada. One COVID legacy, let's hope, lingers.
Well, that week, Adrian just detailed, changed life in Canada, leading to an incredibly difficult 5 weeks. And you have had lots of questions about COVID-19 in that time. We have been answering as many of those questions as possible each and every night, and we're going to continue to do so. Tonight, we're asking your big picture questions. Where are we with the pandemic, and when will life get easier? Joining us now, Dr. Taslim Nimji, an ER physician, and Dr. Isaac Bogosh, an infectious diseases specialist. Hello to the two of you. Dr. Nimji, first question goes to you, particularly because of your work in a hospital. It seems hospitals aren't seeing the surge many were fearing. Where is your anxiety level now about our healthcare system getting overwhelmed?
You're certainly right that we are breathing a little bit more easily today than we were 6 weeks ago when all of this really hit and started. To say that anxiety levels have dropped dramatically would be an overstatement. I think they're certainly not as high as they were before. And you're right that there are some that are speculating that, we may actually be at peak, and we're certainly not seeing those exponential curves that we were dreading. And there is capacity in the system to deal with the influx that we're getting at this point. However, we have to be cautious because you don't want to start peeling back some of the measures both in the community and within the hospitals. And by the ones within the hospitals, I mean, really sort of holding back on surgeries, elective surgeries, as well as some of the other surgeries that we are not doing at this time that we would certainly like to do and not hold off indefinitely. But we have to be very careful to sort of very strategically and methodically look at how we can reintroduce some of that with the capacity that we have, so that we don't do the exact opposite of what we've gained here in terms of not then really sort of overwhelming the system.
Right, because how beneficial is more time? I mean, if Canadians continue to be on good behavior, what does that buy you?
It buys us a lot, and it's very beneficial. We still have a lot that we need to understand in terms of serologic testing, how much of our population is actually immune. For example, if we start really repealing those measures very quickly and having people start re-entering society again as they would have before, we still really run the risk of having a lot of people getting sick very quickly. So there's still a lot of pieces that we need to put together here, including really ramping up our testing, looking at serologic testing, and all of that when we're actually looking at how we can do this carefully.
Okay. Dr. Bogosh, is finding a vaccine the only thing that will make things mostly normal again?
Sadly, I think the vaccine is really our durable way out of this situation. And, we know that that's going to be at least, 12 to 18 months in the future. But without an effective vaccine, I don't think this virus is really going to go away anytime soon. And, we might see places where there's spikes of it. We might see places that might have lower levels of transmission as time goes on, but it's not going to disappear. And unfortunately, we really need to pour all our efforts into having an effective vaccine to really get this under control so we can return to life as we remember before.
And I've heard an awful lot from seniors, from immunocompromised people who feel like they're under house arrest until a vaccine comes out because they have too much at stake. That's going to continue to be true?
Sadly, I mean, we know that those individuals, certainly the population over the age of 60 and people with underlying medical conditions, including people who have suppressed immune systems, these individuals are at greatest risk of having a poor outcome from this infection. And, in the pre-vaccine era, there's only so much we can do, right? How do we protect these individuals from getting this infection? So, sadly, it comes down to physical distancing measures and really setting up policies in place to ensure that individuals who are at risk of having the greatest chance of having a severe outcome just don't come into contact and don't get infected with this. It's hard to do.
Right.
And truly, a vaccine is our way out of this.
Dr. Nimji, what concrete sign are you looking for that might signal we're beating this thing?
Everyone's looking for a sign. We all are, but really, again, this goes back to it being so complex and needing multiple pieces of the puzzle to really come together. And part of that is, as Dr. Bogosh was just talking about, is having a vaccine so that we can then look at moving forward and actually looking in the rearview mirror at this, as opposed to being smack in the middle of it. But certainly to be able to see a decrease in hospital admissions, a decrease in case fatalities, combined with a high degree of immunity in your population, because through rigorous testing and serologic testing that you've come to that point, I think then you can start to breathe a lot more easily than you can right now.
Dr. Bogosh, you see things the same way?
Yeah, I mean, we really need to see a lot of things fall into place before we see life slowly return back to normal. That includes really ensuring that there's a reduction in the number of new cases per day, fewer hospitalizations, and fewer use of hospital resources related to COVID-19. There's a lot of different metrics we can follow that will tell us that we're headed in the right direction.
Dr. Bogosh, Dr. Nimji, I learn a lot every single time I talk to you, and tonight was no exception. Thank you so much for your time.
Thanks, Andrew.
Have a great night.
Now, as we mentioned, we will be asking your questions about COVID-19 each and every night of this program. So send us your questions. You can message us directly on Instagram. That's at CBC The National, or you can send us an email at covid@cbc.ca. Just put the National in the subject line.
It's been one of the biggest changes to our lives. We're being told to stay apart and stay home.
People are asking, can I have a beer with my neighbors if we sit 6 feet apart?
But are some cities asking too much when it comes to practicing physical distancing? We look at that next. Welcome back. And stay home, keep your distance. That has been the message from health officials and politicians for weeks. But some cities are enforcing extreme distancing with some pretty hefty fines. And as Salima Shivji explains, as the lockdowns wear on, they could wear on people's patience.
An eerie quiet in the capital. Parks with no lingering allowed.
I need somebody to hear.
Like many who can't go out, Marcy Thompson is getting creative.
He said, sit back down where you belong.
Singing karaoke to cope.
And they say it might be till late July.
And roping others in too on Facebook.
Everyone's schedules is thrown off. We're just kind of trying to do what works. And for me, music is therapy.
No wonder people are relying on technology after stern warnings from some health officials.
We are hearing about people looking for what I'll refer to as loopholes in the rules around physical distancing. People are asking, can I have a beer with my neighbors if we sit 6 feet apart? Or
he said no, but that was later walked back. Still, there are stiff fines for breaking the rules, like sitting down on an Ottawa bench, as student Alexandra Plante found out.
We had no idea we were doing anything wrong, and like $750 is like a massive amount of money for me. So I'm literally going to make less this month than this ticket costs.
Still, the Prime Minister is calling for every Canadian to sacrifice, perhaps for months.
We all have to do our part to fight COVID-19. As impatient as people are getting all across the country, we need to continue to hold on if what we're doing now as sacrifices are going to be worth it.
It's a fine line. Politicians calling for a wartime effort.
What we can produce, what we can manufacture.
But restrictions can wear thin, says this historian.
Those wars were very divisive events, and they left deep chasms in Canadian society. There are limits on the sacrifices Canadians are willing to make for their country.
An overreach that could erode the most effective weapon against the virus. How willing Canadians are to make sacrifices for the greater good. Salima Shivji, CBC News, Ottawa.
Well, next on The National, a success story from a Canadian long-term care home.
I have this heavy weight on my chest.
How they managed to keep the virus out and save lives inside. But first, our latest COVID-19 how-to guide, what to do about your smartphone. You touch things every day, and then you touch this, and maybe you even put it to your face. So how often should you clean it?
We know that this virus can stick to surfaces anywhere from 2 hours to 48 hours. It's probably a good idea to wipe the phone down periodically throughout the day just to keep it clean.
Now for the case, it sort of depends what it's made of, but generally a little soap and water will do the trick. Now for the phone itself, you want to avoid using tissue or paper towel because that can scratch the surface. You also want to avoid using bleach or any typical household cleaner because there's an oil-resistant coating on the phone that you don't want to ruin. So here's what you do. You take a dry, clean microfiber cloth and you just sort of pre-clean the surface, wiping gently. But for the disinfection, what you want is at least 70% isopropyl alcohol. This is 99%, so it's even stronger, and that's okay. It's not going to damage the phone. If anything, it'll just do a better job killing the virus. And you can just take a little bit, just dab it onto the cloth. This is what Samsung, Google, and Apple all recommend, and the last two actually say typical household disinfectant wipes will do the trick as well. We've been telling you about just how hard long-term care homes have been hit by COVID-19. There have been dozens of outbreaks and hundreds of deaths across the country. But tonight, David Common takes us inside one facility that so far managed to keep the virus out.
Our first red wine.
Back in normal times, group gatherings at this Saskatoon long-term care home were the daily high point. Today, the common areas are shut down and have been for more than a month.
We closed the art studio, we closed the spiritual care center, our big Tawa gathering space. our physio gym, our OT area, our greenhouse, our pool.
We first met Sue Ellen Beatty a year ago inside the home she runs, Sherbrooke.
Okay, you good?
They've always felt their different approach has made life better for the seniors who live here. A difference which may have saved their lives amid a pandemic wreaking a devastating toll in care homes across Canada.
I have this heavy weight on my chest. My goal and everybody's goal here is that COVID-19 doesn't get into Sherbrooke.
Sherbrooke took action sooner than most, before any orders came from government, closing the home to visitors, even taking the temperature of all staff starting way back in mid-March, something many other homes still aren't doing. Elders now eat physically distanced, but they can take risks here that others can't, because staff do not move between sections or between homes, as they do in so many other facilities.
We're asking our staff to go straight home, to not be engaging with family members who don't live with them, to not be mixing with neighbors, not going into people's homes or having people into their homes.
Means the residents are part of the workers' bubble, limiting the risk of transmission. Sherbrooke has no COVID cases, and here in Saskatchewan, there are far fewer infections too.
We are in a little bit of an advantage here in that some of the other provinces and countries were way ahead of the game before we got into it. And so we have the luxury of learning from other people.
It's not just that the virus arrived here later or that Sherbrooke acted sooner, but that the home was just better set up already. Its staff less mobile, less likely to carry the virus. The home saw early what was coming and shut things down. Everything but care. David Coleman, CBC News, Toronto.
The Moment is next. We asked musician Joel Plaskett for his take on this moment in time. His musical tribute is next. But first, as we go to break. The great bell of Notre Dame rang today to mark 1 year since fire ripped through the 850-year-old cathedral. The timing coincided with Parisians applauding healthcare workers from their balconies and their windows. COVID-19 has delayed reconstruction efforts, but the French president promises it will be done within 5 years.
Over the past 5 weeks, Canadians have had to adapt to a new reality. Empty streets, schools and businesses closed down, and calls to stay apart. But despite the extraordinary challenges, we've also seen this country come together day after day, finding new ways to spread messages of hope and thanks.
Tonight, we wanted to end the show a little differently and reflect on this moment we're all experiencing together. So we asked Canadian musician Joel Plaskett to share his words with us.
So here he is with his song Frontlines of the Hard Times, a tribute to those whose reality has undoubtedly changed the most. That's the National for April 15th. Good night.
Good night.
And the economic crisis, while we sing a couple verses through electronic devices, for the doctors and the nurses at the front lines of the hard times, for the orderlies and the medics in the middle of the night. While the world is slowing down, let's remember theirs is spinning. As we're turning out the lights, the night is only just beginning. Make more noise! Have we always been connected? Have we been too long out of touch? Appreciate it. As the play went undirected, did the actors say too much? So we return to the center of the wheel. Thank our So let's sing a couple verses for the doctors and the nurses at the front lines of the hard times getting real. At the front lines of the hard times, from the night shift to the daytime, through the dark clouds till the blue skies are